Greetings, friends. I'm Susanna Meyer, Executive Director for Empowered Aging. Happy 2023. We would like to welcome you to our first Empowered Aging Live. And we're talking today about mental health. We're talking about its impact on our professional lives and the work we're doing. We're talking about what happens when you bring that home with you. It's just an open discussion just to kind of get some perspective on what we do, how mental health impacts the older adults and adults with disabilities that we serve. And we're just going to talk a little bit about that. Keep your eyes open. We'll be doing these on a regular basis. And just to give you a few more words about Empowered Aging, our agency has been around for over 50 years. We started as an ombudsman service agency initially, which basically means we protect the rights and the quality of life of residents living in long-term care in Solano, Alameda, and Contra Costa counties. And we also have added to that, our list of resources has grown. We now have, in Solano County, we have friendly visiting, telephone reassurance, elder justice program. We also work with MSW interns, and we are now excited to launch our statewide expansion of our healthcare career pathways. You will hear from representatives of all of our programs today. And as I said, keep tuning in because we'll come back and have some initial thoughts on a lot of other topics. And we look forward to talking to you then. And as usual, ongoing, thank you for your support. And we're going to start off with Charmaine Brent. Charmaine, can you introduce yourself and talk to us a little bit about mental health and the impacts on the work that you do?
Well, hello, everyone, and thank you for joining us or just really tuning in. My name is Charmaine Brent. I'm the Ombudsman Program Manager for Alameda County, which means I provide the services, my staff and I provide the services in the long-term care facilities. We investigate complaints of abuse, neglect, and exploitation. So we serve over like 15,000 residents, and what I want to share in terms of mental health and the work that I do just on the professional side, oftentimes when you're dealing with seniors, people forget about that mental health is real. I can even think about as, middle age or young adults, we're oftentimes told to seek mental health services, whether that's therapy, you have podcasts you can listen to. And I thought about something. I said, I really don't hear about a podcast addressing how do you address mental health when you're maybe like 60, 70. And I think sometimes it's often forgotten about. So when I go out to facilities and just imagine being a new resident in a long-term care facility like skilled nursing, and there may be a lot of anxiety around that. Sometimes residents who have dealt with, various mental health issues, the facility staff oftentimes don't know how to spot that out or how to address that or how to support that or what resources to provide. So just remember when we're thinking about our elders and the population that we are serving, that mental health is real. It doesn't go away as we age. And this is why, as being a part of an organization, Empowered Aging, we are looking at the continuum. And not only that, just personally with my staff, making sure that they are balanced. So when they go out, they can serve and, making sure that they serve our residents appropriately and they're not stressed, because that's an added stress to the population that we serve. So just wanted to give you just like a shot or a synopsis of what my day can look like, and just, be on here and advocate for our seniors, just not to forget that as you can engage our elders, whether that's in community or skilled nursing, that their mental health is real and they oftentimes can have even a greater challenge as they age.
I think you raised some good points, Charmaine, and I think the kind of work our staff does, it can be very disheartening. It can bring a lot of sorrow with it, because we are sometimes working with people who have been the victims of abuse or neglect. So I think that's one of the reasons we wanted to talk today, is because the perspective of the people working directly with victims of abuse and neglect it's going to be a little bit different. And so I'd like to bring in Gina to the conversation now. Can you talk a little bit about that in your work?
Sure. Hello, everyone. I am Gina Wrigley, and I do community outreach, and I work with all of the volunteers, the wonderful array of volunteers that we have, particularly with our friendly visiting telephone reassurance program. We have retired people, we have people who are still in college, we have stay-at-home moms, people who just have time to give an hour a week, every week, and to visit or call one or two of our older adults in our community in Solano County. It makes a huge difference. We all know that social isolation is a big issue with a lot of older adults. We all know how important having a social life is, socializing with friends and family and being in different groups, if it's a book club or, you know, a hiking club or a cribbage game, something. And so these volunteers, they really bring out a lot in the seniors that they visit. And it just makes a world of difference. It just brings their self-esteem up. It makes them feel so much better about themselves. It makes them feel connected to the community that they live in. So it's a really great program, and I'm really proud to run it, and I'm really proud to know the volunteers that serve our agency.
And Gina, what about personally? How are you about bringing work home when you've dealt with something that's heartbreaking? Or...
You know, that's interesting because I do share it with my family, and that helps me. I do bring it home and I do talk about it, and that helps me. But my outlets would be to go for walks, go for hikes, you know, hang out with friends. But I do need to talk about it when I get home with my family and just kind of, you know, decompress and let them know what my day was like.
Thanks. Tiffany, in your role at the agency, you've probably got a different perspective from others. You want to share that?
Sure. So I'm Tiffany. I'm the administrative manager here at Empowered Aging, and we're big on the practice of self-care here. We encourage it a lot. And so the first component of self-care is encouraging and informing staff of all of the services and resources we offer them for both physical and mental health. I make sure that they're well versed in various avenues of care so that they can reach out and get the help that they need. We also have a system where we offer one work from home day each week to ensure that all of the staff here is recharged and ready to go and just decompressed as much as possible. We encourage personal time, and we also are big on not taking your work home. You know, home is home, work is work. So work-life balance is super important here at this agency, and we do put our employees first.
Thanks, Tiffany. Don J, do you have some thoughts on this? I mean, I know we've talked a little bit about how the people we serve are often neglected themselves when it comes to resources for mental health. And what do you see in your work on this topic?
So hi, everyone. I'm Don J. Sanders. I'm the program manager for the Solano County Ombudsman Program, and I'll also be representing for the Elder Justice as well. In my line of work as an ombudsman, I see a lot of residents who are depressed, who are sad, who feel like they're unrepresented or unheard because their diagnosis kind of takes over what people see of them. It takes their identity away. Their families think that they're doing the right things by making decisions and not keeping them informed or letting them have a word. So in my job, I explain their rights to them and let them know that you are still a person, you are still human, you do have rights regardless of what people may think. No matter what your diagnosis is, you still have rights. So we let them know that no matter what, you are important. And with the Elder Justice Program, just giving victims of crime there and victims of abuse an outlet to let them get the courage to advocate for themselves, because this causes stress, fear, anxiety, and an exacerbation of their own psychological impairments they may already have. So adding to that, it just adds more stress and an increase in a decline in mental health as well. So we just give them a voice and let them know that we're here.
Thank you. And how do you avoid bringing that home? And I say that in a way that you can, like Gina was talking about this at home and almost using that like a therapeutic method of getting through the hard things. But everybody does have their own methods when it comes to being okay when you're not at work. What do you do for that?
I try to maintain a healthy work-life balance, so I know when to turn it off. Like Gina said, sometimes I do have to express without, we keep confidentiality first, but I do kind of express some of the things, or just to spread the word so that my children and family are aware that these things are happening in the world. But I also know when to turn it off. So I love music. I have a dog and a cat who keep me entertained. So just learning to know when to shut down and to tell myself that it's okay. I don't have to be doing something all the time.
Thank you. And I'm going to hand it off to Dodie, and Dodie will talk about a little bit about the work that she's doing. Completely different perspective. In fact, you might need to give us like a 1 or 2 sentence overview of what you're doing so that people understand why your perspective is so different. Thank you.
Yeah, thank you. And thanks everyone for tuning in. We're super excited to start this series here at Empowered Aging. My name is Dodie Zotai, she, her pronouns, and I am the director of the Healthcare Career Pathway Program. So it's an innovative partnership of public and private organizations that we launched partly as Empowered Aging with a couple other organizations in Contra Costa County. So Mount Diablo Adult Education and Opportunity Junction, with the support of the John Muir Community Health Fund, as well as some other partnerships with like Loaves and Fishes and the Food Bank. And really, our innovative model is about providing workforce training and professional development curriculum integrated with wraparound supportive services for individuals who have addressable barriers. So these are individuals who aren't typically successful or don't see themselves as successful in education. They might have a trauma background. Actually, a lot of our students do. We have a high number of like single parents and individuals that don't have the socioeconomic resources, right, to access. There's really a lot of barriers in general. And what the program does really is has case management supports, and the program is about helping individuals get into healthcare, starting with the certified nursing assistant training. And as we all know, in long-term care, residential facilities, and even assisted living facilities, our CNAs are the backbone. They're the eyes and the ears for the residents and the individuals in long-term care. And when we support those folks, right, when they know how to take care of their mental health, which is a core part of our curriculum, actually, they're able to transfer those skills and those strategies to support the residents, to support their coworkers, to change their family tree in a lot of ways. And so our program really is about this long-term culture shift for individuals. We really look at the data, which is a really unique part of our program, and the students, their circumstances don't change in 12 weeks. So the program and the training is only 12 weeks long. So their circumstances don't remarkably change. But what we find interesting is that their ability to manage trauma and challenges, they already come in a lot of times as resilient folks because they've had lives before, but they now have these strategies that they've developed and worked through in something we call the personal success plan, that looks at everything. It looks at the spiritual, the mental health, the physical health, the financial resources, and also where does someone want to go? What is their journey? So some core values of our HCP program is about person-centered. We really look at each individual as who they are and what they need. It's about growth mindset. And so it's kind of that thing of like, I can learn hard things, I can do hard things if I just have the tools in my toolbox to do it. And the last thing is about restorative justice. It's looking at how do we address trauma or wrongs and turn them into something that we can restore kind of what has broken or has been kind of harmed in a lot of ways. And so I love that because we're multi-level. We're supporting students, we're supporting educators, we're supporting the leadership team like those folks at Empowered Aging, and then the residents and those folks who are working in long-term care. I really love that. And we're taking this program statewide. The state has decided that we're a model program, which is really amazing. And so we're able to hopefully impact other communities in the whole state of California. So that's super exciting that I get to help with the team to do that.
Thank you. And I think Dodie's points bring up something interesting about Empowered Aging, is that we do have some programs and resources that are kind of on opposite ends, but really altogether what we are doing is supporting older adults and adults with disabilities. And, through friendly visiting, through the CNA program of the people that are going to be serving our residents of long-term care, and obviously through our ombudsman program. So the interns that we bring in as part of our MSW internship program, some of those after they graduate will move on into geriatrics, for example. So really, in a nutshell, what we are trying to do as an agency is advocate, and protect against neglect and abuse, and just really help residents of long-term care and then residents outside of long-term care through friendly visiting, et cetera, to have the best quality of life that we can possibly give them. And I think it's a hard thing to do when you've got a group of such dedicated staff members. And I want to say, like, everyone on this screen and all of our staff members, every team member at Empowered Aging is incredibly dedicated. And truly, you do have to be dedicated, first of all, to do nonprofit work at all, because we all know it can be very demanding, but also because the kind of work specifically that we're doing, we are seeing some things that are heartbreaking. We're seeing some things that, we do our best to impact. We can't always change something to the degree that we wish we could. We have to follow the laws and the state mandates. And if someone refuses the support that we can offer, there's some barriers there we have to work through too. It's a really hard thing to do, but I mean, I have to say it's so fulfilling and it's empowering, which is of course where the name came from, but it's empowering for us to know that we can make a difference every day in the work that we're doing. And I want to talk one more little bit about ombudsman with either Charmaine or Donjay or both. And if you can talk about the feeling of empowerment that you're getting from like maybe share a little bit about a difference that that you've made, or a little bit short story or something like that. I'm putting you on the spot. I didn't warn you I was going to do that, but honestly, ombudsmen are every single day in the facilities where some of these really challenging things are happening. And so the stories that you've shared with the rest of the team, sometimes those of us that are on the inside of the agency, not as much front facing or direct service related, we're not going to get the same feeling that you're getting. And so I'm hoping that either one or both of you can share a little bit about that.
So outside of, investigating complaints or looking to things like that, I get a lot of joy in empowering. And like I said earlier, we do empower them to speak up for themselves. We're advocates, but what brings joy to my heart is when they get the strength and courage enough to advocate for themselves. And they do that because they know that we're in the background. We know that we support them. Well, they know that we support them, and they know that they have a team behind them. So just seeing someone that's really timid and really scared and maybe facing verbal or physical abuse, and then you see them and they're like, no, I told them myself and look what I got from speaking up. So that's the empowering part, and that's what I love.
Yeah, and I have a similar story. Just two things that pop out really quickly. One, I had a resident, and she used to be a dancer, but she broke her both hips, and so made a little more frail. She had to have, her one of those little rascals that you ride around. But her husband they were New Yorkers, and still had a lot of his strength. So he was going around fighting and advocating for his wife. He was taking over what we call a care conference, where he addressed the needs of the resident. But I noticed that the facility and the husband were going back and forth, and no one really considered what was going on with her. No one heard from her. And you could see just sadness with the back and forth, and just asking her, me spending time with her, asking her, what did she want? She was sad because she didn't want to hurt her husband's feelings, but there were certain things that she wanted, and she didn't want to cause confusion with the facility. So her and I strategized a plan. And I remember at the care conference, I said, you're going to sit right in the front at the head of the table, and I'm going to sit next to you, and you can do this. And at the end of the care conference, during it, she was able to advocate for what she wanted. I said, make a list. It's be okay. Take a deep breath. And at the end of the care conference, her doing her fist like this, like, yes, I did it. You heard me. That makes all the difference. And that's kind of, what we're saying when mental health is real. And if we're not really cognizant of just some of the small things, that was in somebody else's mind could have been an afterthought, because they felt like the stronger person, which was her husband. You were dealing with him because they both were in the facility, but we lost sight of her and what was happening. Depression was setting in. She was there alone, even though she was around others, had to think about she couldn't dance anymore. She said, I know I did certain things where I would fall over because I just wanted to do it. But she was trying to bring attention to herself, like, I matter. So as Donjay said, empowering others. And just one really, really quick, I have to share. There's another resident, he's blind. And this was something as simple as activities. And they called me in and said, can you talk to Mr. So-and-so? Because he just gives us so much trouble. And he said, every day they play bingo or something else. And I can't do any of that. And I said, well, why? He said, I'm blind. And they don't have any activities for me, anything that I can do. And so he was very disruptive. He had to be in a new facility. He really couldn't see. this was new for him. So they saw it as being disruptive. And that was a form of anxiety and depression. Something as simple as we have these Google Home drives that we were giving away, and they're it's like the tool, "Hey Alexa," and I asked them, "What kind of music did you like? What year were you born?" And he was like, "I like Otis Redding and these different things." And so I brought in a Google Home Drive for him, and then also taught the activity director, you can go around the room asking people what music was popular at the year they were born. You can teach them how to ask the weather. I said, do you want to learn another language? You can do that from the Google Home Drive. So that sits now in the center of the activity room. And then it also he has one in his room. And so now he smiles. He said, yeah, I listened to Al Green last night. Anytime I come in, he tells me that. Empowering. And he was just in his room kind of forgotten about. And if he hadn't said anything, they just really saw him as a difficult resident. And look how that impacted his mental health. Yeah, he was very ornery. He was mean. But something so simple now, it's like just night and day. Night and day.
Because he's been heard, right? And that's so important. And I think that's one of the biggest reasons that each one of us does the work we are doing in every capacity is to help people that don't typically have a voice or who are underheard to actually have that voice and to be heard by others. I wanted to mention, we've talked a little bit about volunteering as it relates to friendly visitors. Our ombudsman departments are in need of volunteers as well. Solano County, Contra Costa County, and Alameda County. And there are positions that are similar to what an ombudsman does. They actually are going into the facilities and advocating for residents. But there are some things that are not necessarily in the facilities, if it's something that makes you nervous, but you still want to help. Maybe something a little bit more administrative based to help with discharge process, that kind of thing. So Gina, can you help people understand how to learn more about volunteering?
Oh, sure. So I am the volunteer coordinator for all of our programs. So not just the friendly visiting program. So if anybody is interested in the ombudsman volunteer program, something on more of an inside the office kind of thing, party
ambassador. We talked about our ambassador. We have a new position we're creating, ambassador.
Right. Ambassador. We're in the works of planning some events for different reasons, and we would love anybody that's got kind of an event background. We're looking for an ambassador to kind of take charge and kind of be my third hand and fourth hand and help with all the other volunteers that we have. But you can go to our website, empoweredaging.com. I'm Gina Wrigley. I'm on the website. You can .org. Sorry, empoweredaging.org. And find me on the website. You can get my email, my phone number, give me a call, email me, and we can go from there.
Thanks, Gina. Tiffany, I'm going to close out in a few minutes, but I wanted to give you another chance just to talk a little bit about the internal side of things. And I say that because we're not as directly involved in that connection. But how do you feel about hearing these stories from your coworkers, and do they charge you when you hear them?
Yeah. It gives the work a lot of purpose. It makes me want to do my job even better for you guys so that you can continue to do the work. I admire the fact that you go out and work with, for lack of better words, a forgotten population, an overlooked population. And so it's encouraging. Our aging adults need everything that's offered. And so I want to do my part to ensure that you're able to do your part. And it's pivotal work. And I'm happy to be on the team.
And Dodie, did you want to add anything before we close some things out?
Yeah, I'd actually love to, especially, a lot of what Don Jay and Charmaine were sharing their stories and kind of just piggybacking to on Tiffany. The part with the HCP program and training CNA students, our graduates are empowered to understand how ombudsmen are such a resource and a support, and that they too have a kind of a duty and a responsibility to advocate for their residents as well as themselves. CNAs, unfortunately, historically, have not necessarily been compensated for the level of work that they do. And we advocate with the students and we teach them tools on how to do that. And so they're able to, turn that and support the residents. Understanding that ornery residents, there's a reason a lot of times why folks come in. And because our students have those traumatic backgrounds, they're actually able to understand the residents and why they are acting out the way that they do. And that just being heard, right? I think, Susanna, you said it, like having a voice or having your voice heard can empower you so much. And, kind of what Charmaine had shared about how she sat with that resident and was able to support them. Our program does that with students so that they in turn do that with the residents. And then, for us as well here at Empowered Aging, for us to
and that's a good point too, Dodie, is because part of the training of the CNA students that Dodie is that program she's leading is in skilled nursing facilities, working with the residents that we serve. So that it does all kind of tie together and loop around, and it's a bit of a wraparound in itself, just the agency and the work we're doing. The other thing to note about that is that a lot of the students, as they graduate at the ceremony, are offered jobs. There is
before graduation.
We're in crisis mode here when it comes to state direct workforce. We're in crisis mode, and so the care level at the residential facilities will very much be dependent upon the staffing. So as an agency, we are working towards addressing that end of the abuse and neglect. And it's hard to talk about, but frankly, the better staffed a facility is, the less chance there will be.
Yeah, because staff are able to take care. Yeah, staff are able to take care of themselves. They're not overworked, right? So a lot of time these individuals are single parents, typically, Black and brown women or immigrants and folks that don't always have a voice in our society. And so then they're taken advantage of also in the work. They end up working multiple jobs. So when we are able to add to the staffing, give them the resources, connect them, right? California has the master plan for aging, caregiving that works. Like that's what our program falls under as a model program. When we support the folks in long-term care, they're better able to support the residents because they take care of themselves better, right? We talk about work-life balance. Tiffany, this organization is so amazing at that for us, having that provided in each facility. And I do want to reiterate too, our facilities that work with us for HCP are high road employers. They want to make better culture at their facilities. And so that's the other thing. So when a facility is working with the healthcare career pathway, also they're working towards growth and change and being person-centered also. That's one of our requirements for the industry partners.
We're picky about who we partner with.
Yes.
It's a very structured program, and it's seeing great success, which is again why it's been recognized by the Master Plan for Aging, by the state of California, and why we were able to bring Dodie in to help with that expansion. So I'm going to close things out and just remind everyone that we would love to stay engaged with you. We have a regular newsletter that comes out. You can sign up for that on our website. Again, like Gina was talking about, some of the volunteer opportunities that we have available that we'd love to bring you onto that team. Obviously, if anybody wants to throw some donations, whether they're one-time or monthly, we'd love to have you there. Once we start getting into events, we'll invite you to those. We really want to make sure that we're more accessible, that we bring these to you on a regular basis, and that we hear from you. So as we promote this live recording thing that we're doing right now, we'll share the website link and ways to reach out to us. So please, again, engage, email us, call us, reach out on social media, follow our pages. We're on Instagram, Facebook, YouTube, LinkedIn, but reach out, tell us what you think. And if you have a family member or a neighbor or someone that is living in long-term care, especially, and in need of support, please reach out to us for that too. We will help. It's in Solano, Contra Costa, and Alameda County. Check our website out, learn more about our programs directly, and please join us next time we go live, because we really, really appreciate the community support and the partnership out there. Thanks, everyone. Bye.